day everyone, I am Mizel Faith Delgado, a student nurse from Iloilo Doctors College, and for today I will performing bed bathing. First is, what is bed bath? Bed bath means bathing a patient who is confined in bed and cannot have the physical and mental capability of doing self-bathing. Next is the purpose of bed bath. First and foremost, it is the way to clean the patient's body from virus, bacteria, and germs that may foster in his or her skin. Second is to improve circulation and general muscular tone of joint. Third is to help them feel comfortable when they need to sleep. And lastly, to observe skin condition and any other objective symptoms. Before proceeding to bed bathing, there are some guidelines to be followed. First is to follow the doctor's order because sometimes it may changes. Second is to check the patient's information and condition because in some cases, there are patients who are experiencing hemorrhaging, pain, or feel weak that the bed bath is not suitable for them. And lastly is to greet the patient and establish rapport because it is important to know the patient's hygiene preferences and also to ask the patient if they're willing to help us when doing the bed bath. Prior to the conduct of the procedure, make sure that you prepare all the equipment needed for bed bath. Also, perform hand hygiene and donning of gloves to avoid cross-contamination and infection. And also, close the doors and curtains to provide privacy to the client and the nurse. All the materials are now fully prepared and I am now fully sanitized. Let us now proceed in validating the information of the client. First thing to do is greet the client. Ask the client of his or her name and birthday, then explain to him or her why you're going to do the bed bath or the purpose of the bed bath. Also, ask him or her if he or she could assist you or lend his or her hand while doing the bed bath. Hello sir, may I know your name and your birthday?
I'm RJ Rigayas. I was born on August 2, 2000.
So hello Sir RJ, I am your nurse for today. I'm Nurse Diesel and for today I will be doing your bed bath. So in doing bed bath, we're going to do this because it can help you clean from the germs, virus, and bacteria, and also it can help you feel comfort when you need to sleep. So sir, when doing the bed bath, are you willing to help me?
Yes, ma'am.
So first is, can you check the temperature of the water if it is favorable to you? Okay, thank you. The next thing to do is to undress the patient or remove the patient's gown. Then put another blanket at the top of the patient. After you have covered the patient, remove the patient's pillow and put another towel at the back of his head, then another towel at the top of his chest. And now we can proceed to bed bathing. Now, can you remove your gown? debris of the eyes and to avoid infection. Next to proceed is cleaning the client's face. In cleaning the client's face, we can now use soap if they preferred it. When cleaning the client's face, we can use the number 3 pattern. From the forehead, to the nose, then to the chin. We can also include cleaning the ears and the neck. After cleaning the patient's face, we can now proceed to cleaning the upper limb. When cleaning the upper limb, we can now use the soap. So in cleaning the upper limb, it should be from distal to proximal. We should use long stroke so that it stimulates the circulation of the patient. So now, cleaning the upper limb is now done. We can now proceed in cleaning the client's chest and abdomen. In cleaning the client's chest and abdomen, you should put a towel under the client and put some towel on his or her chest to provide privacy. With this, we can now change the water because the water is now cooled down and it contains different microorganisms. Now that the chest and abdomen is done and the waters changed, we can now proceed to cleaning the lower limb. In cleaning the lower limb, it should be from distal to proximal. In cleaning the back of the lower limb, we should raise the leg a little bit so that we can clean the back of the leg. After cleaning the lower limb, we can now proceed in cleaning the back of the client. In cleaning the back of the client should be in a lateral position so that we can have an easy access and visualization of the client's back. After performing all the steps in bed bathing, we should make sure if the clients feel comfortable after taking the bed bath.